Thank you for having us today. OneOme is honored to support this series. OneOme was co-founded by Mayo Clinic, and our vision is a world where medication decisions are optimized to each patient's genetic profile. We enable healthcare teams with evidence-based pharmacogenomic testing and analytics to help improve outcomes and reduce costs through personalized medication decisions. We provide a variety of solutions for our partners. Most of them are end-to-end. We offer a comprehensive panel of 27 genes that supports care for a variety of conditions and specialties, like mental health, oncology, pain management, and cardiology. Our solutions are customizable with a variety of solutions to meet the needs of our partners. We offer workflow support for providers, including EHR integrations and real-time alerts. Our clinical team supports us with training, education, decision support applications, and clinical consults. There are some changes that we feel are critical to make pharmacogenomics a standard of care. Dr. England, will you please highlight those for us?
Yes, and thank you, Julie. This is a common question and an area that we like to support our partners in. How do we bring pharmacogenomics to the standard of care? And there are several things that come to mind. The first is the education of our providers. So we know that there's many providers that did not have exposure to pharmacogenomics in their training, whether in their medical school or their residencies. So we do have some suggestions we like to offer. The first is, of course, webinars like we're attending today is a great place to learn about pharmacogenomics. The second is many academic institutions do offer CME courses now in pharmacogenomics, as well as PGX certification courses. I also like to point out when we're talking about educating providers, let's not forget about educating our nursing staff as well. Nurses are often, or medical assistants, the first point of contact for the patient, and patients may ask the nurses or the medical assistants questions about pharmacogenomics as well. So I really do believe in training the whole healthcare team. Secondly, is we have seen great success when a healthcare system or a clinic will have their own local PGX champion. And this is often best done by a clinical pharmacist. So as we all know that clinical pharmacists are experts in the therapeutic use of medications. So when a healthcare system or clinic can have that local PGX champion, that really helps the programs go well, and they can help provide considerations to the provider about medication selection and management. The last thing is we need to think about workflow support. We know that if it's too laborsome or cumbersome, that providers will order the test a few times and then stop doing it because we understand that they're very pressed for time. So we need to provide them with tools and solutions to help them with their workflow. A couple ideas, of course, would be EHR integration to help order the test, get the test results. Also, clinical decision support is very helpful as well to give that clinical actionability to the provider. And then, as mentioned just previous, of course, a pharmacy consult, whether in real or an e-consult, is where we've also seen a lot of success. So we do believe that, again, educating the providers, the collaboration of the clinical pharmacist and the provider and this workflow of support will help to expand the clinical application of pharmacogenomics into the standard of care. The second area that we get a lot of questions on are, what are the best practices for pharmacogenomics? What should we be looking at? And so really two things for that come to mind. The first is standardization of clinical lab testing. This is done by AMP, or the Association for Molecular Pathology. They do have several guidelines out now, which is recommending a minimum set of alleles or variants that a clinical lab test should be testing. These are out for CYP2D6, CYP2C19, and CYP2C9. And this will really help to bring standardization to all the clinical labs. Again, to recommend the minimum set of variants that a lab should be testing. The second is the professional guidelines for gene-drug interactions, such as CPIC and DPWG. These guidelines will offer providers an approach of how to translate that lab data into something that they actually can do, recommend clinically and have some actionability. We do know that there are some discrepancies between CPIC and DPWG, but in recent months and years, they are really trying to align and improve that. So we do need consensus between the two organizations as well to improve that ambiguity. So with that, I would like to say in summary that pharmacogenomics has come a long way. We will continue to recommend best practices. We will support that and improvements. And I really do believe that pharmacogenomics is very close to becoming standard of care. Again, webinars like today will really help with that. We thank you for listening. Please feel free to reach out to us at OneOme for any questions you may have. We're happy to answer them. And enjoy the rest of the program. And thank you for having us.